Good afternoon, everyone. Thank you so much for joining today's orientation. I really appreciate that you're taking the time out of your day. I'm sure you're busy students, very possibly new to Canada, but definitely new to this school year. So I appreciate that you're taking your time out of your busy schedule to attend this session. It's a very important session. Students that were previously insured with us, there's been a change in previously insured with Northern College, there's been a change in your insurance provider to StudyInsured, and any new international students, which I think is the majority of you who are attending today, are going to learn about the product that supports you and your health needs during this school year. So I appreciate your attention. I am going to be sharing a PowerPoint that's going to be available to you through the international office. So if you do need to review any of the slides at any time, you're welcome to do that. Before I begin, I also want to let you know that there is a chat feature within this meeting invite. So if you do have any questions that you'd like to ask, you can ask them personally in the Q&A section, and it's only seen by the administrators here, or you could privately message me and I'll make sure I address those questions throughout the presentation, or rather I'll probably answer them at the end of the presentation. I think the presentation will answer a lot of the questions, so you can always put them down. If they end up being answered, then that's great too. But without further ado, I am going to share my screen here. I'm going to turn off my camera as well because it's going to help me out. Let's just make sure that's the right screen. Good stuff. I'm going to close my camera just because I am going to be focused on the screen to my left. Shrey, can I get a thumbs up if you can see my screen okay, please? Perfect. Alrighty, so let's get going. So this is the StudyInsured insurance orientation for Northern College. We're going to start with some insurance basics. So something to keep in mind is that you might have heard that Canada has a national healthcare system. But unfortunately, international students in Ontario are not eligible for the same coverage that Canadians do have. It's something simple like a trip to the clinic, or for a flu or an eye infection, can cost you roughly $100 to $150. Whereas something more significant like a broken leg or an overnight stay in hospital will be into the thousands. So one of the things to keep in mind is that because you don't have access to the Ontario healthcare system, Northern College and StudyInsured have partnered together to provide you with emergency medical insurance. So this is a private health insurance plan to make sure that you can get the medical care you need when you need it. You do have access to all of the same facilities that Canadians have, which is nice. But unfortunately, we are a private payer as opposed to the public payer system of Ontario. Now, what do you need to know to access the insurance? Northern College has already enrolled you, so there's no action required by you. Something to keep in mind, however, is that even though your insurance started September 1st, you are not going to receive your wallet card until October. So I know that's probably one of the most burning questions in your minds right now is, how do I know I have insurance? How do I know I'm enrolled? Trust. If you are an international student at Northern College, you will be enrolled into this insurance and you will receive your medical wallet card in October. By the end of October, if you haven't received your card, that's a good reason to contact the Northern College team just to reconfirm your enrollment. When you get your confirmation package, you're going to have several attachments. The main attachments are going to be your policy wording, as well as a claim form, and most importantly, your wallet card. But there's also going to be instructions on how to use the virtual healthcare. That means seeing a doctor over video chat. And then we also have instructions on how to register for our member portal. Now, the wallet card is going to be the most important element of your confirmation package. It is a card that you should keep with you at all times. So we do recommend printing out a few copies. Again, this is a PDF, so you can print out as many copies as you need. We recommend keeping one with you at all times, making sure a loved one or perhaps a roommate or somebody that is close with you also has a copy of this card. So in the circumstance where you need medical care and you're not able to access it, they have a copy. We can resend this card at any time to any email address, so don't hesitate to to call us up and ask for it to be resent to you if you somehow misplace your card. Now, you are going to be asked for this card when you are seeking care, both for for on-campus medical facilities as well as in your communities. So make sure you have it at all time. Something to keep in mind is that the coverage is only available to current students. So Northern College will make note of your coverage dates on your card. But if you are disenrolling from the program for any reason, your coverage will be canceled by the college, okay? So make sure that if you are leaving your program for any reason, but you're staying in Canada, that you make alternative arrangements for insurance, because the expiry date is limited to while you are a covered student. Now, the insurance plan that supports you is called the Explore Canada plan. It is an excellent plan, very robust, but it is designed for unexpected illnesses and injuries. So that means you've come to Canada healthy and happy and ready to go, but you're a human being, so you might discover that you have a sore throat one day, or an eye infection, or you've tripped on a sidewalk and injured yourself and need to see if you've broken your ankle or things like that. These are the kinds of things that are covered. It also covers big emergencies. So if you unexpectedly need surgery, or there's something where you need to be medically repatriated, all of that is within the plan as well. Now, this plan can be used worldwide. So if you are someone who travels on your downtime, no worries. You are covered outside of Canada. The only place you are not covered is your home country. So keep that in mind, that your coverage is suspended while you're in your home country, but you are able to travel outside of Canada with this plan. Now, the other advantage of this plan is that it's supported 24 hours a day, 7 days a week by a multilingual assistance team. So they're available to support you in the language of your choice and do everything from guiding you to the right medical care facilities to helping you submit your claim and making sure you get reimbursed for any out-of-pocket expenses. Just one more note on the using this plan outside of the country. The only restriction to that is if you're going to be going to the US, it's limited to 30 days per trip. And you also have to spend the majority of your policy period in Canada. So keep that in mind. The intent of this is that you spend the majority of your time in Canada while you're on the policy. So your StudyInsured health insurance coverage is very robust. It covers almost every area of medical care you could possibly need. And of course, as mentioned earlier, you can use any medical care facility. So we don't have any restrictions on where you can receive your care, as long as there are medical doctors licensed in Canada to provide that care. So hospitals, clinics, and of course, our virtual health service are all included in the package. You are covered for emergency dental care and 1 oral health exam per year. There are paramedical services such as chiropractor, physiotherapy, massage therapist. This is the kind of service that's provided to you on a referral basis after you've had an injury and your main doctor has told you you need this type of service to recover from that injury. It is not designed for you to receive paramedical services without a referral from a doctor. We also have very robust mental health coverage on this. We want you to recognize that your mental health is just as important as your physical health. In addition to the insurance, Northern College has also arranged for you to be a part of our Stay Healthy at School program. And I'm going to talk about that after I discuss the basic medical insurance with you. So keep online for that discussion as well. It will cover emergency prescription drugs. So when we are talking about emergency prescriptions, we are talking about things that will relieve pain or the symptoms of an illness on a short-term basis. So antibiotics, ointments for rashes, pain medication for an injury, these things are prescribed to you on a short-term basis, and they will be included in your coverage. And last but certainly not least is emergency transportation. That ranges from anything from a taxi to bring you to a space if an ambulance is not able to get to you in time, or something major like repatriating or returning you home to your home country to recover after a serious illness diagnosis or an injury that requires multiple months of recovery. Now, some things to keep in mind: this insurance is a private plan, so it's not going to cover everything. Your exclusions are listed within the policy wording, and you can learn more about that by reviewing the coverage or asking us over the phone if certain things aren't covered. But something to keep in mind is that unstable pre-existing conditions are not covered. So if you are someone who lives with a chronic condition and you routinely see a doctor or a physician or a specialist to help you manage that condition, those kinds of payments will be out of pocket. And that also goes for your medications that are prescribed for you to use on a daily basis. So the prescription medication benefit on the plan is for emergency prescriptions. So those are short-term prescriptions, but anything you take routinely every single day is not covered by the plan. And last but not least, elective tests or third-party requests are not covered. So again, this plan is designed to relieve symptoms of an illness or injury. It is not designed for elective testing. So if you have a program requirement, for example, that says you must get this test done or you must have this procedure done before you get your placement with us, that kind of thing is not going to be covered and will be paid out of pocket. Now, when it comes to support and services, we do our best to be available to you 24 hours a day, 7 days a week. And we do that through our StudyInsured assistance team. This is a team that's available by phone, and they have access to more than 380 languages. So if your level of English or French is not something you are comfortable with, we are still more than happy to provide you with service in a language of your choice. Now, we will, of course, always answer your questions about the coverage itself and making sure that you have support with submitting your medical claim, help with locating your provider, and of course, assistance with submitting your claim. But if you have any questions about exclusions or limitations or anything, you are always welcome to ensure that that is a part of it too. I'm just gonna stop. Oh, there we go. I'm just making sure. I saw some people pop off, so I just wanted to make sure that my screen was still sharing. Okay. Okay, next one. So I did give you a note that you are going to be receiving your medical. Oh, let's make sure that that's actually being shared. You are going to be receiving your wallet card in October. So if you need any care before you receive your wallet card, I want you to know that you can still call the StudyInsured assistance team. This is kind of the flow or the steps that will be taken. So number one, you're going to call the StudyInsured assistance team to open your case. So you're going to say, I'm a Northern College student. I don't have my wallet card yet, but I will be getting it in October. However, I need to see a doctor because I've injured myself or I'm really sick and I need to get to a medical facility as soon as possible. You are most likely going to have to pay out of pocket. But at certain facilities, they may just provide you with an invoice or a receipt for an itemized list of the services that you received, and they won't necessarily ask you to pay out of pocket, but they will essentially give you a deadline on when that bill needs to be paid. And the important thing is you hold on to that, and once you get your wallet card, you can submit that to us, and if your claim is eligible, we'll make sure we pay that bill. If it's not an eligible claim, then of course we will let you know, and you'll be able to have an adequate understanding of why the plan did not cover that particular expense. Now, when you receive your wallet card, again, you can call us back and we can provide all of the guidance you need. You can provide StudyInsured assistance with your wallet number, and then we can or wallet card policy number, and then we can update your case with all that information. And then you're welcome to submit your claim online. I should have mentioned earlier, the QR code that you see up on your screen will put that phone number right into your phone. So that's why that QR code is up on the screen, is just to make it a little bit easier to get the StudyInsured assistance right into your phone. Now, your student insurance website is going to be a really great resource for you to learn more about the coverage. Here you will see the policy wording, claim form, summary of benefits in multiple languages. So this is a really good website to bookmark. It does give you access to the member portal, our how-to guides, links to buy insurance for family and friends, things like that. And of course, it also gives you access to our online virtual health service. So in that regard, you do need your wallet card and policy number to access the virtual health. So once you get your wallet card, so receiving care after you get your wallet card, simply go back to that website and click Need to See a Doctor, click here. So again, studyinsured.com/Northern College. You click the banner that says Need to See a Doctor, click here, and you're brought to our virtual online page. This is a service that's available 7 days a week, and you can register once you have your policy number. And this is essentially for any minor illness. So the same things you would go to a walk-in clinic for, you can, or your on-campus clinic for that matter, you can use the virtual health service. So things like rashes, sore throats, eye infections, upset stomach, urinary tract infections, UTIs, earaches. You can see some of the samples or the examples of the services that are provided. And it's going to be a lot more convenient for you. It's completely cost-free, and it's very, very slick and swift. You will be able to see a doctor in as little as 15 minutes. Simply click on Get Care once you registered your profile, and then you fill out a quick intake form, and you'll be able to connect with a doctor to have your consultation. Now, if you have an injury or something more serious that is requires in-person support from a doctor, you can use our Find a Doctor tool. You do have on-campus services, so that should be a first choice for you as well. Very convenient, and you'll always know where it is. But in the event the campus clinic is closed at the time that you need medical care, you can go into the greater community, visit hospitals and clinics to make sure that you get the care you need. So using the Find a Doctor search tool on the student website is also going to be very helpful for you. Again, you need your policy number. So this is something that you would do after you get your wallet card. But basically you put in your policy number and it will populate a map for you of all of the facilities in the area that you can get medical care. Now, this is a very dry topic, so I understand if you've kind of nodded off at this point. The best part of my presentation, or the most important part, is right now. So I do require you to zoom back in and focus on this next slide, and that is to let you know that if you have a serious illness or injury, so I'm talking about hospitalization, so you're staying overnight or you're admitted into hospital, if you have the need for an MRI or a CT scan, if you require surgery of any kind, biopsies, invasive diagnostics, or if you receive care outside of Canada, it is very important that you call us as soon as possible. We give you a full 48 hours for a notification period, but if you don't notify us within 48 hours of your serious medical concern, you will have to pay 20% of your bill. I mentioned earlier in the slides, Canada's healthcare system, while it's a wonderful healthcare system with really high quality care, it is also very expensive. So in order to make sure that you are not paying thousands of dollars for hospital stays, we want you to make sure that you call us right away so we can manage your case and take care of those bills right off the hop. Now, when it comes to making a claim, we try to make this process as simple as possible. Of course, we need certain information in order for your claim to be processed properly. That includes making sure we have the right policy number, contact information. We need the dates of service and where you had your appointment. If you had an injury, it's important to tell us how you've injured yourself. Not enough to say broken leg. We need to know how you broke your leg and where you were when you broke your leg, because they are processed in different sections of the policy depending on how that injury came to be. Now, another important part is letting us know if you have any follow-up appointments or recommended courses of treatment. We also need copies of any of the documents they've given you, invoices, payment receipts, prescription receipts, medical records, anything that the doctor has provided to you, you should keep a copy of and make sure we have a copy too. And last, we will like to pay you back for any out-of-pocket expenses, of course. So make sure that you are have your bank info ready. So once you've gathered and prepared all of these different elements for your claim, you're going to come back to your website, studyinsured.com/Northern College, and you're going to register for your student portal. So your student portal, again, you need your policy number in order to register, and you'll need your last name and your date of birth. So that is all of that information is going to be what we received from the Northern College team. And when you register online, you'll be able to pull up essentially this page that has a series of tiles. And the first tile on your top left is going to be the Submit a Claim tile. So when you're ready to submit your claim, you log in, you click Get Started, and then you basically fill out the forms that we ask you to fill out. That's all electronic, all online. You upload any of the documents that you were provided. We will accept photographs. So if they're giving you paper documentation, just simply take a picture of it, make sure it's legible or easy to read, and then upload that onto the system. And then you click Submit. And we will process your claim within 7 to 10 business days, as long as we have all of the information. If you're missing information from your claim, we will let you know via email that you have a status update in the portal, in which case you would come back to the portal and you click View Claim Status. And in that section, it will tell you what you're missing from your claim in order to complete the procedure. So for example, if you claimed for an antibiotic, but you did not provide us with the drug identification number, that is typically located on the prescription receipt. So if you've forgotten to upload your prescription receipt, we're not able to process the claim without it. So we're going to ask you to upload that, and you have the opportunity to attach it at that time, and then we'll process your claim fully. So just to recap, when you're ready to submit your claim and you have all of the information, you can go to, I'll go to the back one. You can go to log into your portal, click submit a claim. You fill out the forms that are there, and then attach any of the information you have and click submit. If we're still missing something, we will let you know, and it will be in the claim status section of your member portal. If you have any questions at all about your claim, please do call us. Again, the assistance number is available to you 24 hours a day, 7 days a week, to provide you with more information. Alternatively, you can email the claims team directly, studentclaims@studyinsured.com. So that's the section that I wanted to present on the international student insurance portion. So I'm going to pause here and make sure that we have all of the information. I'm going to stop sharing my screen. And I'm going to check for the questions that might be there. It looks like you have about 14 participants. Any questions? Unanswered. How do I generate my student insurance card? Yes, you'll be getting it in early October via email. We will also, you'll also be able to retrieve your card in your student portal. So once you have it and you've logged into your member portal, it will be available there too, but you do need your policy number to create your student member login. Doesn't look like there are any other questions about the insurance, so that's great. Sounds like that was quite thorough. I'm just gonna give everybody 1 more minute.
I believe we have a question as well, Stephanie, from one student. I'm just gonna unmute them so they can actually ask their question.
I was going to ask because I joined late. The previous provided link was saying invalid code. It took a while for me to access this new web link for the Zoom meeting. I wanted to know if the coverage covers prenatal and child delivery, and if it is still possible to add a family member to my coverage.
That's a great question. So when it comes to family members, we have a separate website. It's studyinsured.com/Northern College Family. Once you have your policy number, you'll be able to enroll your family members, and you pay for that service online using a credit card. So you will need a valid credit card in order to arrange that coverage, but it is the same plan that you have. So that's one advantage. And I'm sorry, I missed the first part of your question. Can you repeat the other part?
Yeah, if the insurance policy covers prenatal and child delivery.
Oh, prenatal, yes. There is a maternity benefit. Now, the situation is that the student or the person who is pregnant cannot have arrived to Canada pregnant. That would be a pre-existing unstable condition. But if they fall pregnant while they are in Canada, after their policy starts, then there is coverage for well baby care, prenatal care, as well as delivery of that child and complications. So they do have limits to that. So I believe it's $25,000 for a healthy pregnancy and up to $50,000 for a complicated pregnancy. So if there's a situation where a partner or a student has fallen pregnant during the coverage period, then you can get more guidance with that from the team. Now, again, the student is, if they are already pregnant, they will not be covered. It is designed for students that fall unexpectedly pregnant during their stay in Canada. Does that help you with your question?
Yeah, but let me explain my situation. My wife is pregnant. I'm in my second year of study, so she got pregnant this year.
I see.
Okay. I'm just like this. Before it used to be another insurance coverage.
That's right.
But now this StudyInsured is just coming up with Northern College. And based on my findings before, the previous insurance was supposed to cover. But now that it's StudyInsured, I want to know if StudyInsured would be willing to cover the delivery expenses and all.
Right. Yeah, so we do. There is a situation. It's called it's essentially the legacy clause, also known as a grandfathering clause, that allows students to transition to our coverage. So as long as there was no break in coverage, so as long as you had continuous care, it shouldn't be a problem. But you do have to call the StudyInsured assistance team as soon as possible to open a case so that we can help monitor that care.
Okay. Thank you.
Okay, so once you get your policy number, I encourage you, or you can call in advance if you'd like, let them know that you'll get your policy number in October. But in the event that your partner needs care soon, you may have to pay out of pocket and then submit it at a later date. But like you said, you're a continuous student, so it shouldn't be a problem to get reimbursed for any of those costs.
Okay, thank you. So the policy number will be coming in until October for international students?
That's right. So about mid to late October, you'll receive an email that will have your wallet card, and the wallet card will have your policy number on it.
Okay.
Okay.
And the deadline to add family member will be after I receive the policy number or before?
Yeah, that's a great question. So there is no deadline to enroll a family member. I have put the link to the Northern College Family website in this chat here, so you can always bookmark it for yourself. And perhaps I will save an extra slide in this presentation that gives more information on the family, so that when this presentation is shared with the group, you'll have direct access to it as well. But there's no deadline. We don't have a similar structure to the previous provider. You can purchase the coverage at any time, but it is only valid from the date you purchase it going forward. So as soon as possible, you should be arranging coverage for your family because there's no backdating.
Okay, thank you.
You're welcome.
Thank you.
Perfect, Stephanie. We do have one more question as well, which is about eyeglasses and contacts, if the policy covers those expenses.
Yeah, that's a great question. So on an emergency basis, so if you've had an injury to your eye, then we will cover that, but it does not pay for glasses or contact lenses for regular corrective vision. There is a benefit on the policy to provide glasses after an injury up to $200. And then the other thing to keep in mind is that an eye exam is included on the plan. So that's still a part of your overall health package. You can receive oh, sorry, did someone jump in there? So just to reiterate, you have an eye exam available on the plan, even if the glasses aren't covered. There are several providers that can, that have pretty good deals out there. I know that there's a company called Specsavers, and they have complete lenses and frames for about $80. So you can definitely adjust for something that was within your budget. But unless there's an injury to your eye, then glasses are not covered. Any other questions?
Thank you, Stephanie. I don't see any more in the chat at the moment.
Yeah, neither do I. Okay. Oh, Edna, sorry, you're on mute.
So I just wondering, so the family, like the spouse or the other dependent, it's use the same link to be enrolled as the visitors to Canada?
So visitors to Canada is different. So that would be someone who
Okay.
is not a spouse or a dependent for the child. So we do have a separate website, StudyInsured.com/Northern College Family. That is for the family. So that's a spouse, a parent, or a child.
Oh,
So
I see that. Okay, I see.
Yeah.
Oh, all right, got you.
Okay,
But
I'll
sorry.
I'll link the, that's a really good reminder, actually, Edna. So under the resources section, I'll add a new link that directs people to family, or we can make it the main message on the homepage of the main website to direct.
Yeah, I don't think
students
this information is on our college main website. It's not there. We
Okay.
only have the visitors to Canada there. Shri, can you follow up after the meeting to make sure the family enrollment page is linked on the main page as well?
Definitely. I know it's under resources to enroll a family, and it has a step-by-step guide that we have been using.
Okay.
But I'll make sure that I contact marketing and have it added to our website too.
Okay, thank you.
Yeah, I think, Sherry, we actually have a meeting tomorrow on some of the website links, so we'll make sure that's a part of the agenda. Thank you, Edna.
Okay, thanks.
It looks like there might be another question in here. Dental exam. So the dental exam is covered up to $150. It is available to students after the first 3 months. So you won't be able, you're not eligible for the exam until September, October, November. So after November, you're able to get your dental exam up to $150. There's one per year. Good question.
If you don't mind, I can help ask another question, which I think international students will always ask. It's about the eye check or the glasses, purchase or new glasses. If you can share more information about that.
Yeah, sure. I actually addressed that right before you might have missed it. So there's an
Oh,
eye
sorry.
exam and yeah, that's okay. There's an eye exam included in the coverage. So students can always go to get their eye exam to test their visual field, but the glasses themselves are only covered if they've had an injury to the eye that has changed their visual field, and it's covered up to $200. But just regular lens care and corrective lenses are not covered by the plan.
Okay, so the eye check could be regular check, like we have the insurance, or it's just for emergency, some incidents.
No, it's a regular eye exam.
Regular,
So you
okay.
don't have experienced an emergency to use the eye exam. There's also an annual health checkup. It's also a non-emergency benefit. So students don't have to be in an emergency situation to get a physical exam or an eye exam.
Okay, great. Thank you.
You're welcome. Great questions from the group. Just want to make sure I give one more minute. Looks like there might be another question. What is the policy number and when will students get that? So this is a question in the Q&A. Again, you will get your policy number on your wallet card, and that's going to be delivered to you mid-October. So you will get an email from MSH StudyInsured, and that will have attachments. And one of those attachments is your wallet card that will have your policy number. So you will be getting that once the final enrollment list is received from Northern College. We had a little discussion prior to the start of this orientation, and that was that there was a deadline of day 10 for enrollment. So now they're just finalizing the last final student list, and then StudyInsured will receive that enrollment list and we will issue all the cards immediately. Okie doke. Okay, so now I'm going to talk a little bit about mental health, because I think this is another really important element that I want to make sure you are all aware of the supports that are available to you. So I'm going to go and share my screen again to discuss the Stay Healthy at School program. This is a separate from the insurance, so this is not related and you don't have to submit claims in order to use this program. Can you see my screen okay? Yeah, perfect. So I'm going to stop my video again so I can cycle through these slides without any distraction. So we're going to start with a little bit of understanding of what mental health is. So something that you need to keep in mind is that as a human being, you're going to consist of both physical things, that's your body and your physical health, and then there's also going to be your mental health. Your mental health includes everything from your thoughts and emotions to your feelings and connections with others. And of course, most importantly, your resilience, or your ability to handle stress and life's highs and lows. Something to keep in mind is that mental health is a spectrum. So all of us are on a mental health spectrum, and at different times in our lives, we're going to feel pretty good and on the one end of the spectrum, and other times, depending on our situation, we're going to feel lower. So if you think of it as kind of like a ruler, you're going to be somewhere along that ruler, and that's something to keep in mind, that there's no such thing as 100% perfect mental health. It's going to vary throughout your life and throughout different circumstances. It exists in all human beings, from the youngest child to the oldest grandparent. We all experience mental health and our connections with others in different ways. And it is a key marker of our overall health. So here in Canada, we are actively trying to reduce the stigma related to mental health and ensuring that people understand that taking care of your mental health is just as important as taking care of your physical health. And, as a person, if you think you've broken your arm, you wouldn't hesitate to go to the doctor and get that assessed and make sure that arm is taken care of. But there is a lot of stigma and there's a lot of hesitation to getting care and getting help when we're not feeling ourselves and when we are experiencing mental disruptions in our lives. So I want to emphasize that this is completely normal. You are under a lot of stress as international students, as newcomers to Canada, new experiences, new climate, new food, new relationships. We want to make sure that you feel supported from start to finish in your mental health, because we want to make sure that you're having the experience that you set out to have while you are at Northern College. And the way we do that is by providing the Stay Healthy at School program. This is a program that Northern College has arranged with StudyInsured, separate from the insurance, so it is not an insurance product. Instead, it is a service that provides you with a mental health phone line 24 hours a day, 7 days a week in more than 100 languages. It's completely cost-free to use. So at no point do you have to make sure you have the budget for mental health care. This is something that is available to you to ensure that you get the mental health care you need when you need it. Now, this is for anything that's going on in your life, whether it's school related or personal. So don't hesitate if you think, oh, you know, this isn't related to how I feel about school. I feel great at school. It's just I'm fighting a lot with my partner, or I don't seem to be making as many friends as I thought. These are reasons to seek help from us, to make sure that you're getting the help you need. Mental health is going to eventually affect not only your physical health, but your success outcomes. So we want you to feel successful and feel like you're getting the experience you have come to Canada for. So please make sure you're reaching out to us for any reason. Something to keep in mind is that it's completely confidential, completely voluntary, of course, and it's completely accessible. So I'm going to start with that note on how accessible it is. Well, you can have that 24/7 phone call. So it's 2 o'clock in the morning, you've been up for hours, you're really ruminating, or you have a lot of troubled thoughts on maybe it's an exam coming up or a fight that you've had with your best friend. And you just can't sleep. That's a good time to call. You can call and get professional counseling on the spot in the moment. If you have, a concern that is not immediate, but you'd like to talk to somebody about it, you can pre-schedule an appointment with a video chat. So you can essentially come online and arrange for a chat with a counselor or a therapist at a future date, and they'll get back to you within 2 days with some options for you. And last but not least, there are in-person sessions available. So if you're someone who feels like you really need to be in the same room with a therapist, they can make that arrangement too. So make sure that you're not afraid to get the help, and you don't need to struggle by yourself. We want to make sure that you know it's completely accessible to you in any of these ways. Now, when it comes to accessing the program, there is a website, ca.helpwhereyouare.com. If you go to that website, you put in the company code SHAS, and then you select your preferred language, and you're taken to a page that gives you lots of information about the program. This includes an instant message option. So if you want to speak to a therapist or arrange to speak to a therapist, you can use the instant message live connect option. And then there's also an intake form to book an appointment in advance. You can do live connect, which is instant message, and then there's also an appointment booking channel as well. Now, there's a mobile app that is called iConnect You. It's available in the Google Play or App Store. It's completely cost free, of course. It's a zero charge app. You just need the passcode, same thing as the online service, SHAS. And when you download the app, you enter that passcode, and then you have the same articles and information that's available through the website. I didn't mention that on the previous slide, actually, but that's good to know. If you're more into like a self-help stage of your mental health journey, you can always read articles and find out some tips on how to, better your circumstances while you are going through your mental health disruption, if you are not ready to speak directly to a therapist. But the therapists are always on call for you if you need to. When you have the app, you can open up this little hamburger menu on the bottom right, and it gives you the opportunity to call instantly, instant message, text message, video call. Examples are on the screen there. So you can explore the articles that are about different topics, or you can use the service right away. So I'm putting that number up on the screen. So it's a different number than the StudyInsured assistance number. The QR code will put this phone number directly in your phone, or you can simply enter it into your phone. But this is, again, a service that's available 24 hours a day, 7 days a week in more than 100 languages. You can pre-schedule appointments, or you can speak to a therapist on call. So we do really heavily encourage you to use this service when you can. We want you to feel successful and be ready for everything that may come your way this school year. Something to keep in mind is that it's one of the things that we see most often is students who are very excited when they arrive to Canada in August or September to start their academic journey. And then the weather starts to turn and the days get a little bit shorter and it's darker out for longer periods. This can really set the stage for some mental health disruptions. So recognize that in yourself, recognize if it's affecting how you do your work, how you interact with others, how you take care of yourself. There's a really big trend for people who are suffering from depression or anxiety to start neglecting their health. So they're not eating, sleeping, or keeping up with their normal hygiene routines. Notice that in yourself, notice that in your friends and other people, and remind them that this service is available to them and they can get the help they need. So that's it on this. I'm going to leave this page up and I'm going to bring myself back on camera to see if anybody has any questions about this particular service. So again, you do not need to submit claims or anything. This is just a free service to access at any time. So it's not an insurance product. You will not be charged to use this service. It's available 24 hours a day, 7 days a week in more than 100 languages. Any questions about the mental health program so far? Okay, so I'll pull it off the screen then. It was really good to have your attention for this. I'm sure it sounds like I'm going to update some of the PowerPoint presentation, and I'm going to incorporate some of the slides of the Stay Healthy at School program into the main presentation, and then you just have to worry about sharing one slide.
Exactly, Susan. That would actually be really great too if you can have them all combined together. So
Sounds
we can
good.
ideally share a link with the recording as well as the mental health plan too.
Perfect. Sounds good. We'll give one more glance to the Q&A section. Doesn't seem to be anything in there or in the chat. So I can give you a little bit of time back in your day. We're about 8 minutes shy of 2 o'clock here. Again, thank you so much for your time. I appreciate you involving me in this orientation so I can speak to you directly and answer some of your questions. At any time, if you need any help, please do not hesitate to call the assistance team. 1-866-883-9787. It's going to be all over the website that you have. It's going to be on all of the different resources, but make sure you keep that number on hand for any care that you need this year. And again, just one more reminder, if you have a serious illness or injury, you must call us within 48 hours.
Thank you so much, Stephanie. Really appreciate your time
you.
today.
It was great to be a part of this orientation. We'll see you next time. Bye-bye.
You too. Bye.
Bye.